this video we are going to look at RTS, that is nothing but the renal tubular syndromes. So under this we are going to compare the two disorders, that is a Fanconi syndrome also versus the Gitelman syndrome. The Gitelman syndrome. So we are comparing both of them. So first we'll be looking at the Fanconi syndrome. So what is the Fanconi syndrome? So the Fanconi syndrome, there is a generalized resorption. There is a generalized resorption defect. So there is a generalized resorption defect, and where is this defect taking place? The defect is in the PCT. Where is this present? It is present in case of the childhood. So it is present in childhood. Now we'll be looking at some causes of this Fanconi syndrome. So as we saw, it was a defect in resorption and PCT. Now what about the causes of this Fanconi? Cause is that it can be due to hereditary defects. The hereditary defects. So it may be due to the hereditary defect. Next, it may also be due to the ischemia. It may be due to ischemia. Next, also the that is a multiple myeloma. Then it can also be due to the nephrotoxins. The nephrotoxins and the drugs. So this was about the causes, that is hereditary defects. Then we move on to the effects. Effect is that there can be metabolic acidosis. So there can be metabolic acidosis, and this is nothing but the proximal RTA. And there can also be the hypophosphatemia. The hypophosphatemia, as well as the osteopenia. So this was about the Fanconi syndrome. Now we are moving on to the Gitelman syndrome. So under the Gitelman syndrome, so this it mimics the thiazide diuretics. So what is the defect here? In the Fanconi we saw that it was a defect in the PCT. Here it's a defect in the DCT, Gitelman. So what is the defect? There is a resorption defect, and the defect takes place in the defect of NaCl. This takes place in the DCT. So what to note is that it presents with what? It presents with in case of late childhood. So Gitelman presents in the late childhood, or it also occurs in the adulthood as well. So what is the cause of this? The cause of the Gitelman syndrome. So the cause is that it is AR, that is autosomal recessive. Next, what are the effects? Effects, it can lead to the metabolic alkalosis, whereas in case of Fanconi we saw it was acidosis. Here it is metabolic alkalosis. It is alkalosis. Next, there is also the severe hypokalemia, and there is also presence of hypocalciuria, as well as there is severe hypomagnesemia. So there is severe hypomagnesemia as well. So this was about comparing the Fanconi with the Gitelman syndrome, and we saw some important points such as the causes and the effects. And to learn and grow daily like this, please do subscribe.